Hi, my name is Christopher Lester, and I'm the president of Professional Planning Services here in Somerset, New Jersey. With almost 30 years' experience of dealing with folks of all ages, we see a lot of folks that come in at age 65 that start to have questions about Medicare. If you're new to New Jersey or you're starting to turn 65, you're probably getting inundated with Medicare information. It's monumental. Or maybe you just have questions in general. You're confused or you heard something from a friend. We consider ourselves New Jersey's Medicare experts, and our team can help you to navigate this complex arena. Today's video is on Part D of Medicare, something referred to as the donut hole. So let us take you through some of the vernaculars and verbiage of this complex arena to help simplify it for you. Look forward to meeting with you. Please give us a call and talk to you soon. Part D, the Medicare donut hole. So the Medicare Part D donut hole applies to only about 13% of Medicare beneficiaries. However, I would say about 100% of people applying for Medicare have questions around this area. So allow us to share with you some of the verbiage or some of the language and help demystify this confusing part. Let's point out a few things before we get started. Let's define the terms at the top of the page. The total cost of medication is the total retail cost of your prescriptions. So that's on the left side. Your cost is what you actually pay. That's that column almost to the end on the right. And then you have something called your true out-of-pocket cost, or your truth, that is all the way to the right. But it refers to the number used to calculate when you will no longer be in the donut hole. And you may hear me refer to this as your true out-of-pocket cost as the truth throughout this video. Let's shift our focus to the deductible portion of our drug coverage. The deductible phase is the first phase of prescription drug coverage. During the deductible phase, you pay the full retail cost of your medication until your deductible is satisfied. Medicare plans have deductibles ranging from $10 to $445 per year in 2021. For this example, we will use the maximum deductible of $445. In this scenario, you will notice that during your deductible phase, your total cost of medication on the left of your screen, the total cost of the meds on the right of the screen, and your true out-of-pocket costs, also on the right side of the screen, are all the same. Keep an eye on those three numbers because they won't stay the same for long. After you have filled enough prescription and paid enough to meet your plan's deductible, you will enter the second phase of drug coverage, which is known as the initial coverage phase. During the initial coverage phase, you may pay a percentage of the cost of the medication, or you may be required to pay co-pays. This is unique to every plan, so make sure to look at your plan details to know your initial coverage expenses. Please keep in mind that the drug costs I'm using are only examples. Now, if we look at the left of the screen, you can see the number that defines the initial coverage limit as $41.30. You will enter the donut hole. Let me repeat that because it's super important. This means that when your full retail price of your medication reaches $4,130, you will enter the donut hole. Using this example, you pay the first $445 for the year in the deductible phase. Then in the initial coverage phase, you pay $1,000 out of pocket. And the insurance company will also pay $2,685 out of their very, very large pockets. Remember, this is only an example, but it is showing that if you add up the $445 and the $1,000 that you pay is where you come up with the $1,445 to the right. Add $2,685 that the insurance company paid, and you will hit the initial coverage limit of $4,130. This is very important to show because it is possible that you will have medication with a low copay that in reality has a high retail cost. This would mean that you would reach the donut hole without actually spending a large amount out of your own pocket. It is very possible your medication actually that you're on only costs you a couple $100, but the full retail cost is in the thousands. making it very easy to hit this initial coverage limit. One more important thing to point out is that on the right-hand side of the page, you will see that the true out-of-pocket cost matches your out-of-pocket cost up to this point. During the deductible phase and the initial coverage phase, only the amount that you actually spend out of pocket counts towards the true out-of-pocket cost. In this example, the $26.85 that the insurance company contributes does not count towards the true or the true out-of-pocket cost. So in this case, the true is still $14.45, even though the medications totaled $4,130. And this is a very important factor to remember later in the video. So keep this in mind. Okay, now it's time to talk about the infamous donut hole, the reason you're watching this video. But first, many of you may have heard that the donut hole is closing and will have no impact in 2021. In reality, it's not true. It's only a small part of the story. If you want to learn more about what the donut hole closing actually means, please check out our other videos and resources. But one more time, I'm going to point out that entering into the donut hole when the total retail cost of your medication reaches $41.30. Now we will talk about the impact, what you can expect and the impact to pay for your medications during the donut hole. And more importantly, how do we get out of the donut hole? First, let's take a look at a cost breakdown for brand medication. For this example, you can see on the left side of the chart that the brand name medication is $1,000. Okay? When you're in the donut hole for 2021, you will pay 25% of the retail price for the brand name medication. Something that many people aren't aware of is that the drug manufacturers also give a 70% discount for the brand name prescriptions while you're in the donut hole. But lastly, the insurance company, they're nice enough to pay the remaining 5% of the medication costs. So obviously I'm using nice sarcastically, but now let's focus on what your actual out-of-pocket cost would be in this scenario. So you'd pay only the 25% of the $1,000 medication, which in this case would be $250. And that would be your yearly out-of-pocket cost for a total of $1,695. The next part is very important when it comes to understanding how to get out of the donut hole for the year. Once your true out-of-pocket cost for 2021 reaches $6,550, you will leave the donut hole and enter catastrophic coverage. Now keep in mind, during these examples, you will see how the true is calculated, so pay attention to the true out-of-pocket cost on the right side for brand new medications. You can see that both your actual out-of-pocket cost of 25% and the 70% manufacturer discount will count towards the true out-of-pocket cost. And as you can see, this means that you've already spent $250 on the out-of-pocket. In reality, $950 went towards the true out-of-pocket cost. This is very important to understand because the true out-of-pocket cost determines when you exit the donut hole. So let's continue our example with the generic medication and how they've covered it in your donut hole. When you're in the donut hole, say you pay 25% of the retail drug out of your pocket for this generic medication. Also, the insurance company will pay the remaining 75% of the retail costs. And in this example, we will use generic medication that costs $100. So your actual out-of-pocket cost will be 25% or $25. So up to this point, your actual out-of-pocket cost for this year, adding in the $25, will now be $1,720. Now let's look at how the true out-of-pocket cost is calculated with the generic meds. You can see here the 25% that you paid out of your pocket for your generic meds will count towards the true out-of-pocket cost. The 75% that the insurance company contributes does not count towards the true out-of-pocket cost in this situation. Generic meds do not have the same manufacturer discount that brand medications do. Okay, so let's wrap this donut hole example up by doing one more example with a high-cost brand name medication. On the left, you can see that the cost of the brand name drug in this example is going to be $4,000. Again, for brand name medication, you'll pay 25% out of your pocket, and in this scenario, that would be $1,000, bringing your yearly out-of-pocket cost to $2,720. Just like on the other brand name examples, the drug manufacturer provides a 70% discount and the insurance company contributes the last 5%. Also, like the other brand name examples, only the 25% you pay and the 70% discount will count towards your true out-of-pocket costs. So, which brings the yearly total to 6220 because 95% of the $4,000 medication will count towards the true out-of-pocket cost. We have now finally reached the final phase of prescription drug coverage, known as catastrophic coverage. The reason we will be tracking the true out-of-pocket cost so closely is because once the true out-of-pocket cost is hit, which is that 6550 number, right, during the year of 2021, you will leave the donut hole and then enter the catastrophic phase. Let's briefly talk about what your medication costs will be once you hit the catastrophic coverage for brand name medications. With a retail price of under $184, you'll pay $9.20. While brand name medication more than $184, and you'll pay 5% for the retail cost. So for generic medications less than $74, you'll pay $3.70. And your generic prescriptions with retail prices over $74, you'll pay 5% of whatever the retail price is. I know this is a ton of information, but if you need to, back up this video and you can repeat it. So, donut hole summary. Let's do a brief summary. Only medications of your Part D formulary will count towards the true out-of-pocket cost, which means it's important to pick a plan where all your meds are covered. Again, check out your formulary videos and other information for more details. The donut hole applies to both Medicare Advantage and Medigap plans, so you won't avoid the donut hole by picking one plan or the other. If you do have questions about Medicare Advantage or Medigap plans, check out our other videos comparing the different maximum parts and your deductible for 2021, which will be $445. But many plans will be lower than that, and you'll pay anywhere between $0 and $445 for your deductible. The true out-of-pocket cost is the most important thing when it comes to determining the donut hole. Don't just pay attention to what you're paying for your out-of-pocket. The donut hole is closing in quotations, but it will still impact enrollees. Check out our other videos and articles and more details on that. And thank you guys for taking the time to watch this video and to learn more about the Medicare donut hole. Please let us know if you have any questions. But other than that, have a wonderful day.